Yeah, so I'm going to present primarily findings of an impact evaluation with a large number of partners. I'll show you the list in a minute on the impact of Harvest Plus's orange flesh sweet potato project in Uganda and Mozambique. But I'm going to start off with just a moment. Michael already gave a preface, but on the role of evaluations as a learning tool. I'll then spend most of my time on the findings of the study and a little bit then on our lessons for cost effectiveness and how to scale up an orange flesh sweet potato intervention. So this is an example of a quantitative, randomized controlled field experiment that was conducted in order to look at the effects of OFSP as an agricultural intervention that had explicit nutrition and health objectives. And I just wanted to emphasize that I think evaluations are a fantastic tool for learning about what works, but not just what works, but why things work. I don't think all evaluations have to be randomized. That's a very useful way to construct the counterfactual. It's the most convincing, but we've used at IFPRI a lot of other techniques that I think with the right data and the right contexts can be very effective as well. But one of the limits of an evaluation is that you can only actually, in a very well-structured evaluation, you can only compare a certain number of types of programs or change a certain number of the program components. So you really have to focus on what's the highest priority for you in terms of what you want to learn. But I think particularly for the objectives of this conference, learning about agricultural interventions with health and nutrition objectives, I think this is a very useful way to go. Generalizability can be an issue, so I'm going to show you an example of one where we did this evaluation in 2 countries, which gives us a better feeling for whether results are very context-specific. So this was the Harvest Plus Orange Flesh Sweet Potato Project was the first, they call it the Reaching End Users Project. It was the first time that they had the first crop that was disseminated by Harvest Plus, and so they boldly invested considerable resources in a careful impact evaluation. Orange Flesh Sweet Potatoes was disseminated to 24,000 households in Uganda and Mozambique, starting in 2006 in Mozambique, 2007 in Uganda. The viability of this, the goal of the project is ultimately that you can improve vitamin A deficiency, reduce vitamin A deficiency through consumption, promoting adoption and consumption of orange flesh sweet potato. Whether that's viable as a public health intervention depends very much on getting high adoption rates and on the crop actually diffusing to other households so that you can keep the cost down. And so I'll show you some results on that. Just in terms of context, OFSP is a secondary staple in Mozambique, a primary staple in Uganda. Vitamin A deficiency rates among children under 5 are much higher in Mozambique than in Uganda. So the OFSP project was structured as a 3-pronged intervention. Not only were OFSP vines given out and some trainings on farmer extension to grow the sweet potato, but also demand creation, behavior change trainings were intensive, and also some work on marketing as well. The goal of this evaluation in terms of a learning exercise was about cost effectiveness. So we compared what we cleverly called Model 1 and Model 2. Model 1 being the intensive version, the more costly version, that had 2 years of dissemination of vines and trainings. Model 2 was the same as Model 1 in the first year and then dramatically reduced effort and costs in year 2 in order to compare which approach would be more cost effective. Just in terms of context, again, there were some differences in the programs. In Mozambique, we only have 1 agricultural season a year. They disseminated vines at the beginning of each season. In Uganda, it was possible for farmers to keep the vines between seasons, so they gave out vines only once. And then over 4 seasons, 2 years, the farmers kept the vines going. So the evaluation design, as I said, was a cluster randomized field experiment, a baseline survey at the beginning in both countries, an end-line survey either 2 or 3 years later. The farmer groups or church groups in Mozambique were randomly assigned to either the intensive Model 1, the less intensive Model 2, or a control group. And we had pretty intensive data collection with a socioeconomic and agricultural production survey, as well as a dietary intake and nutrition survey. And we assessed a number of other outcomes than just the few that I'm going to show you here. I can really only give an overview of results. I want to mention just the large number of partners that were involved in this study. There's a list of the organizations that were involved in the implementation teams in both countries. We worked closely with them, both, as Michael said, It was a good example of implementation and research having to work closely together while still maintaining the independence of the evaluation. And also the co-authors on the impact evaluation report are listed here as well, and it was a good example, I think, of economists and nutritionists working closely together on a quantitative evaluation. So here's the first set of results. This was the impact of the project, this integrated project, on adoption of orange Swiss sweet potato. And I've actually collapsed the effects on adoption from Model 1 and Model 2 because they were not significantly different. So this is the kind of average effect of the two models across countries. And what you see there, this is just the level of OFSP adoption rates at the end of the project. So there's a single difference end of project estimator. So we're looking at, in the control group in Mozambique, you had 9% adoption, and in the control group in Uganda, about 4%. And then that large orange bar is the level of adoption at the end of the project. So you had essentially a 68% effect on adoption rates in Mozambique, a 61% effect in Uganda. So in Uganda, where you gave out the vines at the beginning, this was 4 seasons later now. Still almost 2/3 of farmers in the project had OFSP in their fields. Next, I wanted to show what farmers are doing with the crop once they receive it. So this is showing the share of orange flesh sweet potato in total sweet potato area. In both countries, the orange flesh sweet potato were given out in areas where white or yellow flesh sweet potato were available and commonly grown by a large percentage of the sample. The project increased the share of OFSP in total sweet potato area pretty sharply. So these are difference in difference impact estimates. So what we're doing is we take the change in the share of OFSP in sweet potato area in Model 1, say, and subtract from that the change in the control group, and that's how we measure the impact. And in a randomized study like this, you can say that the size of this effect is actually driven by the project. So we find that the project has caused a 54% increase, roughly 54, 55% increase in the share of sweet potato area that's now orange flesh sweet potato in Mozambique. In Uganda, it was slightly lower, but still about a 45% increase in the share of area that's grown now with orange flesh sweet potato. So part of what was interesting about this for us is that the biofortification project here seems to be working exactly as we expected, in the sense that there was not a substantial effect on total planted area. The effect was that people were substituting the less nutritious white and yellow orange sweet potato varieties for now the very nutritious vitamin A dense varieties. So it's doing just what biofortification had hoped to do, which is to increase the micronutrient content of the staples that are a common part of the diet. And here is our sort of punchline estimates. These are the effects of the project on dietary intakes of vitamin A. There were substantial effects on 3 groups that were measured in the study. Children aged 6 to 35 months, children that were aged 3 to 5 at baseline, and then adult women. I'm only showing the results here for the youngest group because they're of the highest priority for nutrition intervention. Again, what you see here is a net increase, again, a difference in difference increase of more than 200 micrograms of retinol equivalents per day in children in this age group. In Mozambique, slightly smaller, but on average, again, around 200 micrograms per day of children in that age group in Uganda as well. That, in terms of effect size, that effect size is actually roughly equal to the recommended intakes of vitamin A for a child of that age. So this is a really substantial effect. Also, we were able to show conclusively that this increased vitamin A intake is actually due to the orange flesh sweet potato. So OFSP was responsible for 70% of total vitamin A intake in Mozambique. This is, again, coming from detailed 24-hour dietary recall interviews with mothers. And OFSP was responsible for 53% of vitamin A intake by the end of project in Uganda. So, thanks. So what does this mean for cost effectiveness? Model 2 was substantially more cost effective than Model 1 because it was about 30% cheaper overall to do Model 2. And the effect size is actually across a broad range of outcomes, much broader than I've just shown here. Were very similar. There were not that many cases where Model 1 was more effective. So that makes Model 2 much more cost effective. And we think that there were further cost savings possible from Model 2 in terms of reducing the complexity and the effort that goes into some of the messaging. So I'm showing average costs here for the project overall, which as a sort of first start is relatively expensive, but the marginal cost of actually doing this ends up being about $18 to $27 across country of essentially adding new communities. And we think that those costs could be brought down substantially through greater diffusion, encouraging greater diffusion, and some other cost savings. Also, once the crop gets established in the fields, if they're maintained by farmers over time, that actually reduces the cost effectiveness even more. Whereas for supplementation, you need to go back every year and provide new supplementation. So we have some more work coming up on this. As Marie mentioned, with support of 3IE, we're going to go back to Uganda and look more at sustainability and diffusion, and hopefully learn a bit more about what makes diffusion work. Thank you very much.